Methadone maintenance treatment. Opioid dependence is a huge issue across the world. Opioid addiction is an illness associated with psychiatric disorders, risk of infection, the transmission of diseases such as HIV, AIDS, and hepatitis C. Premature death and overdosing is also prevalent when using opioids. In 2018, there were 67,367 drug overdose deaths just in the United States. In the United States, 75% of drug-related deaths are caused by opioids. Between 2016 and 2017, 30% more people overdosed on opioids than in previous years. 80% of opioid users go on to use heroin. Between 2015 and 2018, the Council of Economic Advisors found that the opioid crisis cost Americans $2.5 trillion, and in just 2018, $696 billion. The opioid crisis not only increases costs and lowers productivity throughout the economy, it also prematurely ends lives, which have value beyond the effect of economic output. Methadone maintenance treatment, or MMT, is a solution to the nation's opioid problem. Methadone maintenance treatment is the use of methadone that is typically administered over a long period. It is usually used as a treatment for someone who is addicted to opioids. It is used when someone has been unsuccessful in becoming clean, or for someone who is admitted to a substance abuse treatment facility that requires complete abstinence. Methadone maintenance treatment makes it a possible first step towards social rehabilitation because it allows patients to avoid the uncomfortable withdrawal symptoms that result from total abstinence. Methadone may be taken orally as a DTF or drug tariff formula, either red, clear, green, or brown. The color depends on the mixture in the milligrams. Methadone may often come in a 40 milligram dispersible tablet called a disket. It may also come in 5 or 10 milligram pills that are either round or coffin shaped. These pills are only given under hospital supervision. If someone has a needle fixation or would otherwise revert to using injectable heroin, methadone maintenance can be delivered either by IV or IM injection. Once injected, the methadone is dispersed widely throughout the body tissues, stored, then released into the plasma. MMT was first used in the 1940s but gained more interest in research in the 1960s. It is used to treat opioid addiction, other drug use, and improve the health of clients. MMT has been used in Europe, Australia, the United States, and other parts of the world. Treatment is overseen by medical professionals, psychologists, and counselors. Treatment is intended to be rehabilitative and a deterrent for drug users. While methadone can still be an addictive drug, it is much safer than using a drug made up of unknown substances. Patients take a daily dose of methadone intending to replace the desire for illicit drugs with methadone in either a liquid, tablet, or injectable. In the United States, patients are brought to the program voluntarily, while in Australia, MMT has been conducted in prisons.
Now let's look at the benefits of methadone maintenance treatment. So, studies have shown that this method works to reduce opioid addiction, although it depends on the patient's commitment, of course. Retention outcomes were 20 to 25% over 3 years in one study. Depressive symptoms and heroin dependency were reduced. Patients experienced a sense of stability, no withdrawal symptoms, better sleep, and less crying. Patients also experienced increased self-care. Their body was able to heal from what they had done before, and they had improved self-esteem. Now let's look at the consequences of this. Patients may experience the side effects of methadone, which include constipation, drowsiness, amongst others. Patients may also become addicted to methadone. They may also feel weighed down. They have to take legal drugs in order to combat their illegal drug addiction. Now, is methadone maintenance treatment the best solution? It is the best solution to combat opioid dependence because it has decreased the risk of relapse and mortality. Methadone maintenance treatment has also been widely accepted in the United States, Canada, and elsewhere. Systematic reviews have identified this treatment as the most effective treatment for opioid dependence in terms of treatment retention and decreased use of illicit opioids. Overall studies have concluded a reduced risk of overdose death, infectious disease, transmission, and criminal activity. And these are our works cited. Thank you very much.